Transitioning to an electronic health record, or EHR, will not be without its challenges. During this transition process, it is true that an initial investment is required. However, most providers will tell you they've saved a great deal of time and money since they successfully converted to an EHR system. The reality is that in the long run, an EHR enables you to work smart instead of hard. If you're not convinced, visit practices with EHRs in place and watch them in action. Ask questions. You'll eliminate your fear of the unknown and be reassured that the payoff is worth the effort. Providers are comfortable with their paper chart systems, and some are reluctant to let go. But are they really satisfied with them? Most providers who adopt EHRs and learn how to utilize all the bells and whistles are astounded at how much easier it is to get the information they need whenever they need it.
In the electronic environment, when we document in the patient's record, it's immediately available to my peers and partners. If I am out of the office and a patient result comes in and the patient calls the office, my partner can look into the health record and actually review that result and discuss it with the patient immediately. Whereas in the paper environment, oftentimes those things took a lot of time to come back.
When they're working in the hospital and they're about to do a surgery, they can actually go online and be able to look at an x-ray, look at an ultrasound, whatever they may need. If by chance the physician has to work from home, they can actually give an order or be able to prescribe if they need to from looking at their personal laptops or even looking at it from an iPad.
At the nursing home, used to I had two charts. I had the one in the office and the one at the nursing home, and they never matched up because we just couldn't interchange. Now that we can go online, there's one chart and it's all combined together. We're doing the same thing in our own practice. We have 3 practice sites, but all of our healthcare information is in one server, one location. So it doesn't matter if I see you in my Henderson office or the Selmer office, I still have all the same data. That's very important in providing the high quality of care we try to do. One of our offices burnt to the ground on a Sunday morning. The 2 doctors that work in that practice, though, were able to see patients just across the county in one of our other offices without losing any of their charts or any of their information because we have an EHR.
Payoffs resulting from a transition to EHRs include standardization of care and a reduction in follow-up and return visits. These factors benefit both the provider and the patient. The patient has an easier health journey, a better outcome, and more confidence in their care. When the patient has the perception their care is being managed effectively, the provider maintains and attracts patients. They are also able to provide higher quality care to patients with efficient time management.
If you had patients who had high cholesterol, diabetes, and high blood pressure, everyone would be very much aware that those are high-risk patients. But to be able to, in a paper-based world, make a list of those patients would be just impossible. But in the electronic world, it's actually quite possible, and practices that have adopted electronic records have demonstrated that it can make a dramatic impact on the outcome that those patients have and the complications that they have.
Lab work, routine tests, and prep work are just a few elements of care that can be hard to keep up with in a paper-based system. With an EHR, you can ensure that a patient has completed all the necessary steps when making their appointment to make the visit flow more smoothly. Benefits could include preparation for procedure, preliminary lab work, or imaging done at another facility, or agreeing ahead of time to get a routine vaccination when they come in. During the visit, evidence-based decision support ensures that the patient receives requisite care and the visit is thorough. Better coordination of preventive services means maintaining or restoring health before a disease process sets in. And all of this means higher quality care overall.
I believe physicians go into healthcare because we want to help others, and we truly believe that we deliver good quality care. What the electronic health record allows us to do is to constantly report, document, and improve upon the quality of care that we deliver.
Family doctors are good at taking care of patients, one at a time, sitting on the end of a table. And we all think we do a great job. But you know what? It gets late in the day. It gets hard. You've seen 30, 35, 40 patients, and you may tend to forget things. What the EHR allows you to do is, with the pop-ups and the protocols on those late days, remind you of things that you might have forgot.
One of our physicians recently was running a missed opportunities report. Come to find out, one of our staff members here was overdue for her mammogram. When her physician called, she was very gracious for the phone call and actually scheduled the appointment. As a direct result of that mammogram and that phone call from that physician, she was diagnosed with very early stage 1 breast cancer. She was able to begin treatment early, and her comment to me was, "I don't know what I would have done, what could have happened if I'd have waited 2 months or 6 months before having that test."
Prompts are the big thing. If a person walks in for their annual physical and you're prompted that, oh, you're 50, now you need your colonoscopy. Oh, you're 65, now you need your Pneumovax. Oh, it's been 15 years since your last tetanus shot. Let's give you one while you're here. That empowers your nurses to take over some of the responsibility for that care that's being given. But it also makes them feel good that what they're doing is making a difference.
In a paper environment, when the results came back, oftentimes we would file them to the chart. In the electronic environment, we flag those results so that the physician and or their staff who are reviewing the results can see immediately when an abnormal test comes back, and we draw their attention to that so as to prevent accidentally overlooking or missing that opportunity for patient care.
With a paper system, it's hard to keep track of all the patients you see. At the end of the day, when you're staring at a huge stack of charts, it can be difficult to remember which one had this symptom or that procedure. If you've gotten behind and didn't get a chance to make thorough notes, not everything may get entered into that patient's chart.
I'm an adamant believer that all your charting should take place in the room with the patient. Now, I use a computer, so I'm making eye contact with the patient, and I document exactly what the patient is saying when they say it.
When we got our EHR, there was a lot of thought about how it might distract from what we might do with our patients. But we found that we could interact with them better, show them more about their medical care. We can turn that electronic record and use it as an educational tool about how their lifestyle interacts with their health.
Every provider wants to work smarter when it comes to billing and coding. EHRs have a major impact on this process. Information in the EHR is all tied together and either supports or negates the code selected, resulting in more accurate overall coding. The steps involved in electronic coding are more intuitive for many providers. Changes in coding practices are easier to adapt to as well. Practices have seen a substantial increase in their reimbursements based on their ability to accurately document all the services they provide using their EHR.
As I'm documenting the care, I can select a coding tool within the electronic health record that actually provides an on-the-spot audit for me and provides feedback. More often than not, I go to the coder knowing what I think I've done for that service. And if the system doesn't concur, it allows me to spot check my work.
When the EHR system was implemented, they found that they could actually code better, meaning that we could charge more for some of the procedures they typically undercharge for. Also, anytime there was a change in a code within the system, we could change it through one source throughout the entire clinic, which we normally had to do through paper. Now we did it electronically.
Remember that the key to success with any business is to work smart, not hard. Take some time to imagine what it would be like if you could transform your practice in this way. Picture an office where charts are always in the same place, where time spent waiting for information from other providers is minimized or eliminated, where accurate coding brings maximum reimbursement, where employees and patients are satisfied and happy. It's not just a dream, it's reality with an electronic health record. For additional information and resources for EHR adoption, visit 10med.org/adopt EHR.